Good morning and welcome to another edition of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. Dr. Flaharty's been in Southwest Florida for 20 plus years as one of the area's leading facial rejuvenation experts. And I know you love what you do because I see the passion that you have about it every time you come in here, every Saturday that we do this. You're excited about the new techniques and the new technology, and there's always something that gives you better tools and knowledge to do a better job and help us look better and feel better.
Yeah, I do love it. And, the topic today is something that's of great interest to me. And it's a little bit nebulous. And that is, how cosmetic surgery can change lives. Mm-hmm. And, it's sort of funny because, when you go through medical school, I went to University of Michigan. It was a very traditional medical school. Mm-hmm. And steeped in sciences and scientific method and research, and then you end up finding your path to, doing more and more cosmetic rejuvenation, which is, 95% of my practice now. Some of you goes, oh, well, gee, is what I'm doing really worthwhile?
Right.
I'm not curing cancer. Although we do skin cancer. So we cure some skin cancers. But, there's a part of you that deals with that over the course of time. And, at this where I sit now, I say, I'm so grateful for, the decisions I've made and the path I've followed because it really is life transforming. And, I don't want to suggest that, the way you look is the most important thing. It's not. I mean, it's there's so many more important things than how we look. But nonetheless, how we look is a very powerful thing and certainly affects
on many levels.
Yeah, and it affects our life on so many levels in ways that we may not even perceive or know. And so, and I think, I'm starting to get a better sense for that. And in the positive psychology literature and in some of the other studies that have been done in medicine, we're seeing that the power of this is more and more, it's a bigger thing than we maybe initially recognized. And it's funny because you think of when growing up as a kid, when I would go to do an interview or something, and my parents would be like, "Oh no, you get a coat on, get a tie on,
right,
comb your hair, put your best foot forward." You always learn that as a child. That was wisdom. When you go to an interview or you're meeting somebody for the first time or first day at school, put yourself together. And there's power to that. We didn't really understand it at the time. But, the kid that comes in looking good at first grade, the teacher probably notices him more than the kid who's, his shirt's hanging out. And, they may get more attention from the very early stage. And that may lead to him studying harder. And, it goes on and on and on. And it's true for us adults, too. If you look better, just day to day and, look younger and look happier and more vital, then more good things tend to come to you. That I think that's starting to bear out in the science. People are happier, do better, have more success. People who look better, do better, in many things in life because they may have more confidence and people may warm up to them more. So, again, there's so much we don't understand about this, but I think over time we're seeing more and more truth come out that it makes sense to always look your best and do your best.
I do want to talk about the psychology of that a little more, but I want to back it up for a quick second here because you were talking about when you went to medical school, and I always found it fascinating as to how we find our paths in life, and you could have gone anywhere. You could have done anything from medical school. I mean, there's so many different specialties and disciplines within the medical community. I mean, what was it about the cosmetic surgery that really lit your fire, so to speak?
Yeah, so it's an interesting evolution because I didn't start with that. I was actually going to be an orthopedic surgeon, and then I had some really good friends in medical school who were going to go into ophthalmology, which I knew nothing about. And then they were saying, you should really look at this. It's really interesting. And so I had my mom had a cousin who was an oculoplastic surgeon in Philadelphia, a guy by the name of Joe Flanagan. He was very
nice Irish guy.
Yeah, nice Irish guy. So I had never met Dr. Flanagan, but I called him up and talked to him at length, and he's like, "Why don't you come do a rotation with me?" So when I was a medical student, I went out there for a month to Philadelphia and worked at Wills Eye Hospital, where I ended up going for my residency in ophthalmology, but. He was a super high energy guy, and he did a lot of, eyelid and, eye plastic work, which is the central part of the face. And so that really intrigued me. And that was really he was sort of my first mentor in this, which got me into ophthalmology. And then I ended up doing oculoplastic surgery. I did a fellowship at the University of Utah with a guy by the name of Rick Anderson, who is, again, like Dr. Flanagan, a real leader in that field and, internationally renowned, speaks all over the world and, was developed a lot of techniques and was great. And then, after that, once I started practicing doing all this kind of eyelid and face work, I've always had a keen interest in the cosmetic element of things, and everything we do on the eyelids is cosmetic.
Right.
I mean, it may be paid for by insurance, but it has a cosmetic impact. So, obviously it's a very cosmetically oriented field. I did another fellowship in cosmetic surgery where we did more of the face and neck lifts and lower face rejuvenation. And that fellowship did liposuction and other things as well. But at that point, I was pretty much dedicated to face and neck rejuvenation. So that's kind of how it happened. And then, then over the years, you go from 25% cosmetic and 75% functional, which I was, 20 years ago, to now 95% cosmetic. And so I think the more I got into it, the more I enjoyed it, the more I immersed in, learning and visiting doctors and reading the journals and seeing new techniques and going to meetings and constantly trying to find, the latest and greatest, whether it's a new laser or a new technique for facelifting. And, and then you find yourself all of a sudden doing these great rejuvenation cases, and that's your life. So
right.
It's good. I feel really grateful. I've always been very interested in it. It's been a personal journey, and I'm very passionate about it. So, my path to where I'm at is very different than most people, because I started as an ophthalmologist and then an oculoplastic surgeon and then a facial cosmetic surgeon. But I think it's a great path because we've learned the intricate anatomy of the eyes and eyelids and then evolved out from there to, to do more generalized facial work. And I think that's a good way to go because the technical aspects of eyelid surgery are probably the most demanding of anything on the face.
Right.
Yeah.
And that's the first thing you look at. You look at someone in the eye.
Yeah.
When you're talking, most people do anyway.
Yes. Yes. Yeah.
And
no, there's good studies on that, which is really interesting. It was one of the things I was reading in preparation for this, and some talks I'm giving at a cosmetic meeting this year is, when people look at each other, when you're studying somebody or you meet somebody new, most of the tracking goes to the eyes. So you're studying their eyes, and that's how you make judgments about, how old is this person and, what's their general state of health and, are they attractive or not? And, people may say, well, I don't think that when I meet somebody new, but you do. You just don't.
It's like a subconscious thing.
It's a
right?
subconscious thing.
So that'll be our assignment this week. When you meet somebody new, try to pay attention. What are you looking at first? Their eyes or, and your impressions of somebody. Yeah.
Right. Yeah. And, that book by Malcolm Gladwell, which we'll get more into, I think in the next segment, that's that really, I love that book because
Blink, is that the one?
Yeah, Blink. Yeah. And it's really about that sixth sense about in an instant you can know way more than you should about a situation or a person as it applies to like evaluating people. You've met people in your life where in an instant you go, wow, this person is a really genuinely great person. You have a warm feeling. Well, how would you know that? You've never met them before. You know nothing about them. Or, the converse, somebody is like, wow, I just don't trust this guy.
Yeah. I got to move on.
Yeah. I just don't feel comfortable. And most of the time your intuition is right on that. But why would that be? How would you know that? And the reason is there's something else going on. There's a deeper level of understanding that we can't articulate because we don't understand it, but it's real. And it's the same way with appearances, at a subconscious level, you're making judgments about how old is this patient, how healthy is this patient, how active are they? Are they, they are this vital, engaged, really active person, or are they, is it somebody that's, aging and really kind of a couch potato and all that kind of thing? And so, those judgments may all not be fair, but they're kind of at a subconscious level, and we do make impressions based on, how we look.
Yeah. Well, judgments most of the time aren't fair, because you're making that assumption on a limited information. And I know we'll talk about this a little bit more, but for instance, I look at somebody, I'm like, that person's mean. Look at, he's just scowling. I don't want to be around them. And it's not, they could be some of the most beautiful, warm, loving people. They just have those stupid lines that you could take care of with just a couple of quick little injections, on the forehead and the brow area.
Yeah, and that, that's a really common thing that's been studied, just looking at, the frown lines, and Botox, of course, can erase those frown lines, and, the power of just a little bit of Botox to remove your frown lines. I mean, how that can change, really it can change your life. And, again, I don't want to overemphasize the importance of aesthetics. It's how I spend my time, but we try to keep it in perspective too. It's, not the most important thing in life for sure, but it is amazing that, to think that, I know a woman in particular who was a patient of ours who had really heavy frown lines and a heavy eyebrow too, and it made her look really angry. So much so that she said, kids would, like when she'd come outside, kids would run away from her house because they thought she was like the wicked witch in the neighborhood. And she looked that way because she just had that really angry look on her. And we did a brow lift and have done Botox to keep the frown lines away. And boy, it just changed her appearance so much. She looked so much more accepting and happy and, not angry anymore and all that. And it just transformed her life where people, she was much more approachable and people were much more engaging with her. And so, it sounds very trivial, but it actually is real. I mean, it does,
It did change her life. You're right. It was life-changing for her, a little Botox. All right, we're going to take a quick break, and we're going to be back talk a little bit more about how you can look and feel your best with a little help from Dr. Flaharty in just a few minutes. Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. We're talking this morning about how just a little bit of facial rejuvenation can really make a huge impact on your life. This isn't just about ego. This is about the way you're perceived in the workplace, in your home, and the psychology behind getting the Botox or getting the facelift or doing some of these things, that it's not necessarily all ego driven, that it really does make a difference. And the way, because we are judged. You were talking about the book Blink. And I love that book because it does such a great job of delving into that, how we assess somebody and make that snap judgment within the first, 10, 20 seconds or something. I can't remember what the book said, but
yeah, even quicker than that, really in an instant, we kind of have this depth of understanding of a situation that we really shouldn't based on any kind of, experience with it. It's just known. And I think that's kind of how we do judge people, physically throughout the day. And, again, we talk about this, understanding people and, the depth of understanding somebody is, we all know people who, maybe don't care a lot about their looks, but are, wonderful people in so many ways. And so, I don't mean to imply that, the most important thing is looking good because it isn't, obviously there's so much more to life than that, but it does impact our life. I guess that's the main point, is to suggest that, how you look has nothing to do with, how you're perceived in life would be wrong.
Yeah.
And, people who, want to look their best. And I think there's some hidden value to that in other ways in life that often we don't necessarily see or understand. And that's part of what I think Blink, alludes to that. And even some of the studies we've seen with Botox, for example, there's some really interesting scientific studies now coming out and showing that Botox reduces depression, just Botox between your eyebrows, in patients that have depression. It has been an effective treatment for people with depression, and it's relatively new. So like all science, they're like, okay, we need more studies. But there's been about 5 studies that have all shown that using Botox just here in the forehead between your eyebrows, which really takes away the frown lines, has reduced depression. So why is that? How can that be?
Not necessarily the chemical part of the Botox is what they're saying, but it is the aesthetic look of it. And okay, I'm not looking at myself and looking angry and sad, so maybe I see my happy inner self coming out physically. I don't know.
There are several theories as to why that would work. One is, physiology. Is there something happening about the Botox that's creating a change in the way you feel? Well, that's probably not the case because Botox in other areas of the face didn't change it. It was just in this one area. So then the second theory would be, well, your frown lines go away. When you look in the mirror, you look more pleasant. and that makes you feel less depressed. You feel happier because you look better.
Right. That makes sense.
That's possible. The third, and the one I really like a lot, which has a lot to do with looking good and looking happy and being happy and all these things we, talk about in terms of living your life to the fullest, is the concept of mirroring or mimicry. And that is, when you look happier, people who have a frown line, and I used to have it in med school because all I would do is study and I wasn't using Botox yet. Yeah. So, you were constantly had this frown line between your eyebrows. When you have that, you look stern or you look serious or you look angry, you just aren't as approachable.
Right.
Other people may go, ooh, and so, well, I'm not going to talk to that person. But when that goes away, it takes that away where you look pleasant and approachable. And so, mirroring means if I look pleasant and happy, like if I come up to you and I don't have any frown lines and I'm smiling and I'm happy, you're going to probably smile back at me because you're mirroring my emotion. And people do that. You don't, again, you don't think about it. It's natural. If anybody looks you in the face and smiles big, you almost can't help but smile back.
Exactly.
It just forces a smile on your face. And, that alone is probably a topic worth talking about because that would change the world. Everybody's smiling more, right? Yeah. It would help us all feel better. And so the mirroring, I think, is the key where, they use Botox, the frown line goes away, they look more pleasant. People perceive them as more pleasant, so people treat them in a, respond to that in a mirroring way by being more pleasant. And that all of a sudden changes their life where maybe they're not so isolated and they're, they're getting depressed because they're isolated and not being interacted in the same way.
They have communication now with other people and they see that, okay, that's not so bad. Life's not so bad.
Right. So how the world perceives you can change the way you feel. It can change you from being depressed to not depressed. So I think, that's a really important thing. And, again, we don't understand that fully, but clearly, if we look better, we look happier, the world's probably going to treat us differently than if we look sad and depressed and down and out,
Well, I think, when you're talking about this and how these things can lift your spirits or your even your impression of yourself just by looking a little bit better aesthetically. A lot of people who haven't had any of the facial rejuvenation, it might be, I always try to think of something we can relate it to. And for me, it would be like losing weight. So you, even if it's just 5 or 10 pounds, but when you drop that 5 or 10 pounds, man, you feel like you feel confident, and it gives you that, I can take on the world now, because even if it was just 5 or 10, imagine 50 or 100 when people would lose that much. Yeah. And again, it's because of that, like you said, the perception. I'm being perceived as being unhealthy or not sexy or whatever we think people look at us when we have those extra pounds. I think a lot of people can relate to that. And then you put that into the wrinkles on your face and the lines on your face. Then it's like, oh, I can see where getting rid of those would give me that confidence as well.
Yeah, and I think we're all different. And so, and when I look at, kind of the cross-section of my patients, I have some patients that are, really critical of themselves and scrutinize themselves in the mirror. And, that's a common problem that we see in cosmetic surgery, patients who come in and go, oh, well, I'm really unhappy. I've got this wrinkle here or these wrinkles. And, you look at them and they're beautiful. And often it's people that are really, attractive, but they're starting to see some changes and they're freaking out about it. And, you have to kind of talk them back off, back away from the cliff. And, we do often send people home and say, listen, you don't need anything, you can do some skincare, use some products, but you don't need surgery, and sometimes, they want Botox and fillers and they don't even need that, So some people are really hard on themselves. And, when you can make some improvements where they look better, that helps them. They feel better about themselves. And other people, I'm much more this way. I respond to the people around me. So, people who are positive and are feeding positive energy always helps me feel better, better in every way, and better about myself if they're complimentary to me. So I don't really scrutinize, for example, my face in the mirror. I shave every morning, and that's the, that's it. But I know when, if I dressed in a nice suit and people are like, wow, you look good, and you can tell people are, responding to you favorably, that always makes me feel better, just because it's sort of, I guess, an ego stroke, you feel good because people are paying attention to you, they've noticed you, right?
Yes. Yeah, definitely.
Nothing worse than not being noticed.
No, it's nice.
Right?
Yeah, I'm like that too. Put on a new pair of shoes and somebody looks at them and compliments them. I'm like, yeah, That's all right. And someone noticed it. And I know could be a little bit silly talking about shoes, but shoes are my thing. So you kind of have to be a bit of a psychologist as well when dealing with some of these folks.
Well,
right?
Yes and no. We do talk about that, in talking about with colleagues. And I think we're all built differently. So we all have different motivations. So to me, it doesn't really matter why somebody's sitting in the chair talking to me about some aging changes on their face, as long as they have realistic expectations and they're not trying to, think somehow it's going to solve a problem in their life. And, we talk about that too. It's, if they have a problem and they think, having something done cosmetically is going to make this other problem go away, that's not going to work. And, but that honestly doesn't happen that much. I mean, most of the time people come in and they really have legitimate reasons for being there, whether it's, a frown line or, heavy eyelids or, a heavy neck. There's things they see. And most of the time, they feel good, they're healthy, they're well-adjusted people who, when they look in the mirror, are like, wow,
that doesn't reflect how I feel on the inside.
I can't believe that's me. It's like, I don't feel that way, and it is funny because, as you and I, we talk as, we're aging. I mean, I still consider it's amazing because my kids are now, my oldest daughter's in college and, I mean, I consider myself like 18 still,
right.
But obviously when I try to go run 10 miles, I know I'm not 18 anymore. But the point is, we still perceive ourselves as being young and vital and active. And so, as you start seeing changes in your face and your body that, tell otherwise, well, then there are things that can be done now. So you don't have to continue to look older and older and older. You can do some things to look younger.
And I think with the stuff like we were talking about too, the injectables like the Botox and the fillers, it's becoming a little more commonplace. So I think people are more open to that now. It doesn't have a stigma. It's not like I got to be quiet, not tell anybody. It's it's on TV, it's online, and people are getting, I think, a little more educated about that.
Yes, I think so. And, it is amazing. I think, if we're saying, a revolution in rejuvenation, it is really, the injectables are amazing, and I just was thinking about a patient I saw this week who had never done anything, came in a few weeks ago, had a thin face, was looking kind of drawn and aged, some wrinkles around the mouth, sagging of the cheeks. So we just did some injectables to lift her cheek, and some injectables around the mouth for some of the lines and creases, and some Botox for frown lines and forehead. And she came in, 2 weeks later, this week, and looks unbelievable. I mean, it's just like a transformation. Wow. And she was smiling and so happy. And she just wanted like a little bit more filler for some of the, it was like 90% better, but, said, can I do a little bit more? I was like, yeah, we can do, a little more to further improve it. Because that's actually, with some of these fillers, it's the best way. You treat and you wait 2 weeks or a month, and then you add just a little more just to kind of top it off and get a better result. But, looking at her face, it's like unbelievable. When I evaluated her the first time, it was like, okay, again, like the blink thing.
Right.
Here's a patient that's aging who needs some help. And when she came in this week, it's like, bam,
there it is.
Wow, look at this young, vital person who's just sitting there, looks great because of the shape of the face. Yeah.
I love hearing those stories. So how about we take a break, and when you come back, I'll give you some time to think about some of your favorite patient stories, ones that really were profound and really made a difference.
Okay, sounds good.
All right, you're listening to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. We'll be right back. Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. We're talking about the psychology of facial rejuvenation and how it does a lot more than make you look younger. It really makes you feel incredible in a lot of different ways. It makes you feel a little bit younger, gives you a little bit more confidence at times. And I know everyone does it for different reasons, but I love when you share patient stories and give me personal stories about people and how it's affected their lives. I just think that's really cool and powerful. So what are some of your favorites?
Yeah, so there was a story from a number of years ago, but it was a woman who was in her early 70s, and she had this job, and she got fired from the job because she looked too old.
Yeah.
And, you can't tell somebody that, but she knew that because they had hired somebody younger. I think the the franchise had been sold and they were bringing in some new people, and she was let go, and the person who kind of took her place was much younger, and so she ended up coming in, and we ended up doing a full rejuvenation on her, and really she looked amazing. She looked 50, she looked like 20 years younger, and so she ended up going and getting a job at the competitor for twice the amount.
Nice.
Yeah, and
she doubled her salary, and she's 70 years old, and she's still working her butt off.
And everybody in her new place that thought she looked, they're like, "How old are you? You must be. Are you 55?" Or and so she didn't, of course, have to tell, so she didn't. Right. But
I have
been
55.
Yeah. But so that was a great story. That was and she was a really nice woman, and it was nice to see that. And I mean, I think that's a motivation for a lot of people. Really, people are working so much longer now because they're healthy, and I think people are realizing retirement isn't all that it's cracked up to be. And if you like what you do, some people retire to get away from work they don't like, but if you like what you do, then why stop, right? And so but people want to stay current and look good, and quote, compete in the workplace by looking good, and so that's a motivation for a lot of people. A lot of men, if they're in the sales end of sales job, want to stay looking good and young to compete with the younger new salespeople coming up. So that can be a motivation as well. We've had a lot of patients. This is a really fun one. People are always like excited when they get carded at an older age. It's
yes.
like, oh yeah, they but we've had patients get carded because they asked for a senior citizen discount, and they're like, nah, you're not getting a senior citizen discount. Let me see your ID.
Really? That's funny,
a lot. Because I mean, I guess the discounts are fairly substantial, but people are in their 70s and they're like, no, I don't believe that you're over 65.
And then they look at their license and say, wow, you look good for your age, girl.
And honestly, in our office, I mean, we have so many patients in their 70s who look 50. I mean, it's unbelievable how many really attractive, young-looking people there are, in their 70s, who look great.
And how does that spill over? I mean, obviously, the one lady got a new job, but I mean, do you see that when they look younger and are feeling younger? Do you see them come in maybe in new clothing or new relationships or that type of thing? Does it filter into the rest of their lives?
Yes, we see that after surgery, and that's part of the the transformation is again, and that speaks to this sort of changing of this self-esteem or how people perceive themselves. If you do a rejuvenation procedure where they look 10 or 20 years younger, then you don't see them. I usually see them day 1, week 1, week 2, and then see them in like 3 months, and maybe 6 months later, and sometime in that first 6 months, all of a sudden they show up and they're in new outfit, new hairdo, new hair color.
Wow!
And that's really, really fun because it's like, whoa, all of a sudden it's like, it's not, it's this transformation.
They get some sass back in them, right?
Yeah. They feel good about themselves, and they're like, hey, I don't have to wear my hair this way,
Right.
So they have a younger hairdo, a younger, younger cut, younger color, those kinds of things. So we see that, and that's really fun to see. And,
right.
Yeah, and I remember one patient who we had done procedure on, and then she was single and started dating somebody, and and I hear this a lot, women who just say, oh, well, I've got a new boyfriend, and he's like 10 or 20 years younger than I am, and they're laughing, and I don't know, women age better than us men anyway, so it probably makes sense to do it that way, but that's that's
we
always kind of
also
fun.
live longer, so it makes sense to get a younger one that's gonna so you can
and more I see
right?
I see that happening. I see that patients with younger boyfriends, so that's kind of a fun consequence too.
Yeah. So any other ones that I like the one, the lady who was that scared all the kids with the scowl. That's a great story, and I definitely like the one where she went back to the competitor and got twice the amount of salary.
Yeah, that was really good. That was good.
Do you have some more? Or?
Yeah, I mean, there's we do, I still do a lot of chin implants, which I think is an important procedure, especially for men who have recessed chin, because, a strong chin is a physical sign of, kind of power and strength.
Right,
and for
very
a man,
masculine.
Yeah, that can be important. And if you have a real recessed chin, that can really kind of make you look weak. And particular gentleman I'm thinking of where we did a face and neck lift and some liposuction to the neck, but did, an augmentation of his chin, a chin implant, and gave him a stronger chin and a much better jawline and neckline. And yeah, same kind of thing, just, the male version of the new outfit, new attitude kind of thing. He just had so much confidence. He stood taller, his shoulders were taller. And I remember running into him even socially and seeing, how confident he was, in this, mixed social crowd, just, much stronger and more confident in the way he presented himself. So, it can be, something simple like, facelift can be really transforming for people if it helps them regain their, confidence.
Right. And then when a lot of these we've been talking about have been the older, in the 70s and the people who really do feel younger and act younger on the inside. Now they have the outside to match. But what about any of your younger clientele? Yeah,
so one of the things that happens sometimes at a young age, just genetically, is dark circles under the eyes.
Yeah.
So I remember a story or a patient who's actually she was like early 20s, and her mother brought her in because she's like, she's always had these dark circles ever since she was like a teen, early teens, and it made her look like she was tired, or it just wasn't an attractive feature, and so we just put a little filler in the office, just filled in the dark circles, and they just immediately went completely away, and it was just wonderful, to see how happy she was, and her mother was happy for her too, and it's just gone, and that can be permanent. That can last for many years.
Those fillers under the eyes,
under that, because it's such a there's not much movement in the area, and it's metabolically pretty quiet area, and so I've had patients who've 10 years out from fillers there that have held up. And so that's a nice little thing that can be done for somebody who's young. I think patients with acne, too, is another, troubling area for people. And we now have some really nice lasers to help tighten the skin and reduce, a lot of the irregularities of acne.
And the scarring and stuff?
Yeah, it can reduce the scarring, so it can make a nice improvement in the skin. And that's, and fillers can help that, too, and soften that. So, that can help improve someone's confidence, especially if they've struggled with that through the teen years, which is a tough time.
Right, definitely. And those scars. I thought it was very interesting that when you have scars, the lasers kind of make sense, but that you could actually use fillers to even out the little divots that you have. And not just from acne, but chicken pox and things like that.
Yeah, or surgical scars as well. Yeah, fillers are fantastic for that, So we have some nice lasers that help with scarring, and then beyond that, using some fillers to help even it out too. So there's a lot more tools to the trade to help with these things that, in the past we didn't have treatments for.
And I think, the proof is always in the pudding, and I've always loved seeing your before and after photos. And you've got a bunch of those on your website, don't you?
We do, yeah.
And I don't know if any of those stories or the people you're talking about, if any of those folks are in there, but if you go on to azulbeauty.com and you can see some of I know that there's a guy on there with a chin, or at least there used to be, that you were talking about, so you could really see the difference of what you're talking about, the before and after, the strong jawline versus a weak jawline, and the same with the women and the wrinkles in the forehead. And so I just think it's really fascinating to look at that too.
Yeah, it's a great source of information regarding all the options. Our website is got a lot of information about all the procedures we offer and products and different techniques, new technologies. So it's a great source of information regarding all these treatments. Yeah.
Azulbeauty.com. And while we're talking about your website, I'll go ahead and let everyone know you've got offices in Fort Myers and Naples and Bonita Springs, and you could call 415-7576. That's a 239 area code, 415-7576 to find out more about some of these procedures. And you also have informational workshops and seminars from time to time, which are very educational. We could sit down and see and hear and meet the other people who help you do all of these wonderful transformations.
Yeah, I think seminars are really a helpful thing for patients, and we generally keep it small. 20, 25 people. That's a size where people feel comfortable asking questions, which helps to be more informative. I talk about kind of all the things we do. We may highlight one particular procedure, but we do kind of cover the whole gamut so that people can get a good sense for all the things we're doing, new technologies, new treatments. And then my staff is there too, and the other providers, Debbie, Britton, Lisa, Kelly, and other, are there to answer questions regarding skincare and products and the lasers we do in the office and injectables. And so it's really informative. They can meet, one-on-one with us. And anybody who's, heard the radio show, comes in for a consultation. Consultations, we generally charge $150 for a consultation, but if they've heard the radio show or been to a seminar, we waive that fee. And,
nice.
So, if they have an interest, they can call up. The receptionists are really good about triaging and directing you to the right spot. If, it's something like brown spots, you might end up seeing Debbie to talk about a laser or skincare. If something like, neck laxity, then I'd probably end up seeing you to kind of talk about our options, surgical and non-surgical. But, the consultation process is probably the most important way to find out what's best for you, because
right.
that's one-on-one and we can talk specifics.
Gotcha. All right, let's take another quick break, and we will be right back with more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch.
The news and talk of Southwest Florida. 92.5 Fox News.
Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch, talking about how facial rejuvenation, whether it's invasive or minimally invasive, or a lot of the things that you do in your office, how when we look better on the outside, it just automatically does something psychologically. It boosts our self-confidence, our self-esteem, and makes us have that feeling better on the inside as well. Yeah,
I think so. And, we've kind of touched on a lot of those points. And I think in the years to come, we'll learn a lot more about how that works. I think, people do perceive us differently when we look, happier mm-hmm. and more pleasant, or look more attractive, obviously, it helps us personally feel better about ourselves when we look our best. So I think those things are powerful. I guess the question is, where does one start when you're thinking about rejuvenation? And I think the good news is there's so much more that can be done now to help you look your best. Mm-hmm. And during our seminars, we talk about the pyramid of rejuvenation, which really describes all the options available. And that really entails sort of three levels. One is non-invasive. So again, there's so much we can do now with non-invasive technology, modern skincare products or cosmeceuticals, topicals that can really transform your skin. And some of the technologies like HydraFacial mm-hmm. And the light lasers, which are, a blossoming field unto themselves, the types of lasers like IPL to lift sunspots and shrink vessels, mm-hmm. and some of these radio frequency instruments to tighten the skin, Ultherapy to tighten and lift the tissue. So there's a bunch of things we can do, even non-invasively, not only non-surgically, but no injections at all to help rejuvenate the skin.
And that's I love that that's where you start, because if you don't have good skin to begin with, then when you start doing the other things, you're not going to get that maximum benefit. And so many people over the years, I'm one of them, have abused my skin in the sun and maybe not moisturizing or not picking the best products. And it's never too late to do that, at least stop the damage, and then come to you to try to do some of the reversal of the damage.
Right. So in a perfect world, that would be the way to go. You'd start with the skin. You'd get that in the best possible state it could be, which really can be done in about 6 months or mm-hmm. less with topical products and some of the light lasers and skin treatments. And then the next layer of the pyramid is what we call minimally invasive. That's the middle layer of the pyramid, and that would include injectable agents. So the big things there are Botox and the Botox products and fillers, the injectable fillers to help rejuvenate mm-hmm. the face. And that's huge right now, because there's so much we can do now. It's become so sophisticated. So much of aging is deflation, loss of volume. You and I have talked about this a lot, mm-hmm. but I think every year we recognize it more and more. Our faces are like balloons. When we're children, they're full of air, and as they lose air, they start to sag and wrinkle. So it's not just stretching of the skin, it's loss of volume. And so mm-hmm. adding that volume back makes a huge difference, and that's what fillers allow us to do right in the office. Fill in the, not only lines and creases around the mouth, but to lift the cheeks just with injectables, fill in the temples, lift the eyebrows, and, strengthen the jawline. All these areas of the face where we lose tissue that cause us to kind of become more tired looking and hollow and gaunt can be reversed just with injections. And Botox is very complementary to that. The frown lines between our brow or the horizontal lines on our forehead or crow's feet or even the fine lip lines can all be reduced with Botox. So if you add those two things together, we can achieve really dramatic rejuvenation. As I mentioned, the woman we just treated 2 weeks ago came in and looked just unbelievable how great she looked. I mean, wonderful. Like you had this incredible transformation, and you did it just with injectables in the office with no downtime. So, obviously that's a fast-growing area because there's so much we can do. Almost everybody, you could take almost anybody off the street, and you could find 2 or 3 areas you could help them just with injections. Botox and fillers to help them look better. And
that's become a huge part of your practice now, right? Like
it
you said,
is. It's a huge growing part of our practice. So in the clinic, I spend a lot of time doing injections as well as Debbie and Britton. Debbie's a PA and Britton's a nurse practitioner, and they spend most of their time doing injections. So it's a fast growing area because we can achieve so much with just no downtime, which is great.
Get rid of those wrinkles and those frown lines right away and look like I'm happy again.
Yeah. And so that appeals to a pretty broad audience, and obviously younger people who aren't really ready for surgery. It's you can still do Botox and some fillers and help them stay as looking their best
as long as they can,
right? And even older patients who may even be not interested in surgery, we can just hollow cheeks, for example, just using some volume to add some volume back to the cheeks to take away some of that hollowness makes patients even I had a patient who was 95 who came in with their daughter who was 72, and they wanted to talk about fillers, and I ended up doing some I add some volume to her cheeks, and she looked great, and just a couple little injections, and it made her look much healthier, and so why not? It helps people look better, feel better. It's a good thing.
Yeah, especially doesn't matter if you're 70 or 90 or 40. What about then the tip of the pyramid? We've talked about the base, we've got to the middle, and then the tip. What I would assume would be the actual surgery itself.
Yeah, so surgery and surgery, continues to evolve too. So that's important. We now all of our surgery's done under IV sedation with local anesthesia. There's no general anesthesia for any of this. Even if we're doing the entire face, brow, face, neck, eyelids, fat augmentation, that's all done under IV sedation. You don't need general anesthesia. So surgery is faster, safer, and less downtime. With modern anesthesia techniques, the risk of bleeding and bruising is less every year as techniques get better as well. And so things like brow lifts, eyelids, heaviness of the jowls, heaviness of the neck, those things are best treated with surgical rejuvenation. Again, it's IV sedation, it's outpatient. Usually the patient will have, a week or two of relative downtime and then be back to full activity by 2 weeks. So things continue to progress, move forward in the surgical realm too. It gets a little less press because the injectables are and the non-surgical lasers have taken all the headlines. That's sort of the big rage and the hot topic. But surgery, the realm of surgery, continues to get better and better every year, which is really good news because there's certain things we can't fix non-surgically. You can get to a point where you've done everything you can with fillers, Botox, skincare. At some point, surgery is still needed to give you the best possible result.
Okay. And then again, that's where you come in, and we have a long-term plan for our aging, and at least on the physical level, on the internal and mental and spiritual, that's another issue, but they are all interconnected.
Well, I think so. We're all on a journey, and it's, you're trying to find what's the meaning of life, and it always I laugh because I was, just think about this little distinctions you make throughout your life, and you're like, wow, it took me all these years to finally figure that out,
Right.
So, but that's what's fun about it because we'll always have something new to learn and to grow. And, with cosmetic rejuvenation, it's fun because I think people are living longer, they're staying more active, and they want to live a vital, full life, and sometimes, doing things to help them look better is a real powerful boost for people to help them stay maybe more engaged socially or more active in the workforce or just feel better about themselves. So, it's a fun field to be in because it's a good field. And most of the people we treat are really people who are very grounded and really well adjusted and happy in their lives and are just looking to make their life the best it can be. And, that's the good news. A lot of people, who aren't in this field will say, oh, gosh, that must be so hard. I mean, there's a lot of doctors say to me, oh, well, gosh, you must have such high demand patients. And it's the farthest from the truth.
Isn't that interesting? Yeah, there's still that stereotype or that stigma with.
Yeah, that, everybody that would come in for cosmetic surgery would be some really difficult person to deal with. And it's just not the case. I mean, it's probably even the opposite of that. I mean, I think we tend to deal with people who are really, really settled in their life, well-adjusted and doing well and successful and just, again, looking to do things to help enhance their life in any way they can. And that's a really easy crowd to work with.
No
they're
kidding.
really nice, interesting people. We consider them part of our extended family. It's great. We, have patients that have been with us for life, for years. And, we all kind of age together and enjoy the time together. It's good.
Yeah, it's funny because I've heard people say, well, I'm not doing anything. I'm natural and I love myself how I am. And I try to say, well, I don't think cosmetic surgery has anything to do with how much you love yourself. Maybe I love myself so much that I want to look younger. It's not about that, like what you were saying, that kind of a negative spin on the ego. And I'm doing it for somebody else. I'm doing it for myself because I want. Again, I'm looking at it as to look as good on the outside, as young as I feel on the inside. And that's kind of the key there.
Yeah. And I think that's a lot. That's the most common thing we hear. People are like, wow, I'm working out and I feel really good about where I'm at in my life. But I look in the mirror and I'm seeing things I've never seen before and I don't like them.
Let's get rid of them.
Yeah. Whatever their motivation, that doesn't matter so much as long as, again, it's realistic expectations and they don't expect us to solve, other problems, in their lives, of course, which, again, doesn't really come up very often. I think there's a lot of misperceptions about, oh, well, people are this way or that way. They're not. I mean, it's just a normal group of people who, are trying to live a full life and are choosing to do some cosmetic things. But the great thing is nowadays, it used to seem like, okay, you're getting older, but maybe you don't want to do a facelift quite yet. Then what can you do? I mean, the beauty of today's options are that you can come in, you can have skincare, you can do some injections, some light lasers, and really have wonderful results and looking good. And then when the time is right, you can do the surgical procedure, whether that's brow, lids, face, neck, fat, whatever it is. And that's usually a one-time event, and that can make a huge transformation. And then, you go forward just doing the maintenance to keep it looking its best. So, there's something for everybody, no matter what age or where you're at in your life or, how much you want to do.
Right.
There's a place where you can get something done to help, and that's really nice. So it's really opened the field up to everybody.
Yeah, cool. Yeah. Well, thanks for giving us that little psychological input when it comes to facial rejuvenation. It's always interesting, and I know a lot of people think about that too. So if anybody wanted to contact you, azulbeauty.com.
Yeah, that's good. The website's good, and they could call us too at 239-415-7576. That's our office number for all three offices, Naples, Bonita, and Fort Myers.
All right. Thanks for listening to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch, and we'll see you next week, right?
See you next week, Gina.
All right.